Hi, my name's Dr. Rachel Corman. I'm the Feline Internal Medicine Specialist at Cat Specialist Services, and this is just a short video detailing the process that happens when your cat comes in for a flush of their subcutaneous urethral bypass device. So your cat has had a subcutaneous urethral bypass device placed because they obviously have an obstruction to their ureter. And it's very important that we have regular flushing of these devices to prevent both mineralisation from forming within the sub and also to try and prevent bacteria from gaining access to the sub and causing infection in there. Typically, we will recommend that your cat receives a sub flush within the first week of having the sub placed, 1 month afterwards, and then every 3 months thereafter. On the day that your cat is having their sub flush, you'll need to make sure that they're fasted, so no food after midnight on the day that they're coming in for their procedure. Make sure that they have ready access to water, and if your cat has been prescribed other medications, then please check with us, but the likely response is that you will need to administer those medications to the cat on the day. This is particularly important if your cat is receiving antibiotics, for example. If you can't give your cat medications without giving them food, then please just let us know on the day that you haven't given the medications that morning. We will typically ask you to drop your cat off for the day between 7:30 in the morning and 9 o'clock. The staff may ask you some questions when you bring the cat in, such as whether they've eaten, whether they've had their medications, and if there's anything that you're worried about with them. For example, whether their appetite is reduced or whether they're straining to urinate, or really just any other concerns that you have. Once the cats are in the hospital, they go into our cat ward where they may receive a sedation just to help relieve any anxiety while they're here. Once we start their procedure, essentially we take a blood sample to help us monitor their kidney function, and then the process of the sub flush is performed with the cat sedated. We look at their kidney measurements first on ultrasound. So we'll perform a small ultrasound of their kidneys and also of their bladder. And essentially we're looking for signs of dilation within the kidney or looking for signs of irritation within the bladder wall. We then pass a special needle called a Huber needle. And this is a specially designed needle that is able to penetrate into the port without causing damage to that port. So essentially it passes through the skin into this port, and it then allows us to take urine samples from the port. And that urine sample is then submitted to the laboratory so that we can have a look for any signs of infection or inflammation within the system. Once we've done that, we then perform what is called a bubble study. This is where we inject sterile saline and air in tiny amounts into the system while monitoring the cat's kidney and bladder using ultrasound. And here on this image, we can see that we get little bubbles coming out into the pelvis of the cat's kidney on this image. And this tells us that the system is open and flowing appropriately. Once this has been performed, we also then inject a special material, a special liquid material, into the system, which will try and reduce the risk of those minerals forming within the catheters and the port, and it also has antibacterial qualities as well to try and reduce the risk of infection. Once that has all been instilled, we then repeat the ultrasound to make sure that there's no leakage of fluid and that the kidneys appear comfortable and not dilated. And then once the cats have recovered from their procedure, we'll phone you to let you know what time you can come and pick the cats up. We generally get results of the blood tests and the urine testing within a couple of days of performing the procedure. So we'll either contact you or ask you to call us within 48 to 72 hours. So I hope this has helped give you some information on what to expect when your cat is having their subflush. Cats can do extremely well after having their sub placed, and it's absolutely a life-saving device for many cats. But it is a procedure that does require upkeep in many cases of the device. So if you have any concerns or any questions, then please don't hesitate to contact us anytime. Thanks very much.